As an ED nurse, your role is so diverse. Anything can come through the door at any time, so you're always thinking quick on your feet. Being in the country, you need to do all aspects of emergency nursing, so you can be the triage nurse 1 minute, the resus nurse the next minute, and then also looking after a patient on the floor as well.
Certainly for people who love that variety and love to be able to use every skill they have, then working rurally certainly does that for them.
I like the autonomy that we get here in the Riverland. We're able to treat patients as soon as they come in. We have a great working relationship with the doctors that we work with as well, so they trust us and we trust them.
We have a lot to do with our patients because we see them quite often, so our relationship with them is quite strong.
I like living and working in a small country town. I think it's really rewarding to be able to care for people within your own community.
What I see and love seeing in the midwives is the pleasure they get in knowing the women that they are with. They meet them through their pregnancy, they meet them whilst they're in labour, and then they see them when they go home.
I've been a nurse here at Riverland General Hospital for around 7 years. I started as a grad nurse, so I had my TPP here, rotated through the different departments, and then I did my chemotherapy training. So I ended up being like nurse lead in the unit and then cancer care coordinator.
I started out as a ward nurse when I graduated from Flinders Uni here in Renmark. I did a rotation in the emergency on my TPP year, which I loved. From there, I just worked down here more often and then did my postgrad studies.
Being a nurse, you have some involvement with women in maternity. You might be looking after them postnatally or in theatre in the caesarean sections. So just seeing that involvement and being involved sort of pushed me to become a midwife.
Living and working in the Riverland brings something special to your family or a lifestyle that you have.
You work really closely with all the nursing staff and all the medical staff as well. So it's not just related to the emergency department, it's the whole hospital, and you really pull together as one team.
I really love the lifestyle. It's slow paced, you get to know everybody, everyone is really lovely. It's a great place to bring up a family here. You get to become friends with all of the nurses and doctors that you work with.
The best thing about living in the Riverland is certainly the sense of community and support that you gain from the people around you.
The most rewarding part about being an ED nurse is seeing someone come in on the worst day of their life and trying to make it just a little bit better.
Because there are so many things and opportunities available for midwives, whether it's at the beginning of your career, whether it's in the middle or even toward the end of your career.